We will start shortly. Okay. Good morning or good afternoon, everyone, depending on where you are. Please note that this meeting is being recorded. If you do not consent to being recorded, you're asked to drop off the meeting at this time. Thank you. We will wait a couple minutes to make sure everyone joins. Okay. Okay, looks like everyone joined. Okay. Let's get it started. Okay, welcome everyone. My name is Munes Akbaran and I'm a Public Health Project Coordinator at the National Indian Health Board. I welcome you to the COVID-19 Tribal School Preparation for In-Person School Year 2022 through 2023 pre-application webinar. We have a few meeting reminders to ensure our event runs smoothly today. We first ask that you please keep your line muted to eliminate your background noises. We will host a Q&A session at the end of today's session. You will be able to unmute your line and use the chat box to share your questions. This webinar will be recorded and will be shared with those who missed attending it today. The National Indian Health Board, NIHB, is a 501c3 charitable organization created by the tribe over 40 years ago to advocate for improved health for our people. NIHB is the only national organization of its kind. It serves all federally recognized tribes and advocates on all issues related to health and public health in Indian country. Along with many other services, NIHB provides policy analysis and real-time communication to tribes throughout Indian country. It does this work in partnership with its members, the Area Indian Health Board, and in place where no health board exists, with tribes in the region. Now I would like to introduce the NIHB staff who will be working on this project. My manager, Mrs. Sarah Price, and I, Munes Akbaran. Today, we will go over project and application details, including the intent of this mini-grant, review the RFA, including the various categories under which you can apply, the application work plan, as well as the timeline for project activities and application submission. We'll wrap up with an opportunity for everyone to ask questions. This funding is provided by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $2 million with 100% funded by CDC and HHS. The contents are those of the authors and do not necessarily represent the official view of nor an endorsement by CDC and HHS or the U.S. government. The intent of the COVID-19 Tribal School Preparation for school year 2022 through 2023 mini-grant is to fulfill the immediate needs to help students and staff protect themselves while attending in-person school year 2022 through 2023. The funding amount varies between $5,000 to $15,000 and up to $40,000, but it won't be $40,000. It will vary based on the application we will receive. You will receive funding half upfront and half upon submitting your final deliverable statement pending completion of the deliverable. The funding period is approximately October 24, 2022 through May 31st, 2023, and all activities must be completed by May 31st, 2023. In order to be considered eligible for this funding opportunity, applicant must be an official tribal entity defined as a federally recognized tribal government, tribal organization, or intertribal consortium as defined in the Indian Self-Determination and Education Assistance Act as amended. This includes tribally owned and operated schools, federally recognized tribes, Area Indian Health Board, and tribal epidemiology centers. Funding categories and sample activities. One category is material and equipment acquisition, and sample activities are purchasing N95 masks and other supplies to prevent and mitigate the spread of COVID-19 in tribal schools, and purchasing supplies for a vaccination event. The next category is facilities and infrastructure, and sample activities are purchasing and installing computer software for the school clinic to record vaccination, and it will serve as a data sharing. The next activity under this category that you can pick is turning rooms within facilities into isolation rooms. The other category that can be chosen is outreach and education, and sample activities are marketing and education material for COVID-19 prevention, vaccination, and booster promotion in tribal schools and communities. Project requirement. Sign and return a formal agreement with NIHB that stipulates the amount of funds to be distributed, a schedule of fund distribution, tribal points of contact, and deliverables. Complete an agreed upon work plan that will enhance the safe environment for the in-person school year. Designate one main point of contact to serve as the project coordinator. Even if this person is not leading all project activities, the awardee must designate one individual with whom NIHB will directly communicate on all matters related to this project. This person will be responsible for submitting the deliverable statement, participating in conference calls, and completing evaluation activities. Submit a deliverable statement by May 31st, 2023 to NIHB. Within 30 days of the submission of the deliverable statement, share project stories, successes, pictures, and etc. as requested. Additional incentives may be offered to awardee for those stories. Make sure your application is complete. It has two sections, A and B. Section A starts under Appendix A on page 4 of the application. Make sure you accurately fill out this section with the name of the applicant and contact information for the individual to be contacted for notification of application status. Applicant organization, as well as a funding category, need to be selected. We need to know where to send your money to. Section B includes your narrative and scope of work and starts on page 6 of the RFA application. In the blue table shown in the next slide, you can type the details of your proposed work in terms of this component. Objectives. Objectives are the specific aim for your work and should be written so that they are SMART, specific, measurable, achievable, relevant, and time-based. Expected outcome. Please develop an expected outcome for each objective written in the work plan. Each objective should have at least one expected outcome. Activities and deadline. Activities are the specific tasks and work you will engage in to accomplish your objectives. Deadlines are the expected date by which you will complete the activity. Deliverables are the expected output related to the activity. Assigned funding. This is the amount of funding estimated that a specific activity or deliverable will cost. In this blue table, you can type the detail of your proposed work in terms of the component discussed earlier. You will assign funding to the activity and receive funding based on completing this activity. We will not be asking for a financial report. Rather, we will ask for a report of activities completed. Please assign an appropriate amount of funding for completing the activity. Not all activities need to have funding assigned. However, remember that we cannot pay out awardees for funding attached to incomplete activities. Submit all sections as a single Microsoft Word, and you do not need to submit a letter of support. It is optional. Submit your application by email with the subject Tribal School Preparation for School Year 2022 through 2023 application in the subject line to me by the deadline Wednesday, October 5th, 11:59 p.m. NIHB released the RFA on September 6th, and the deadline for the application will be October 5th, 2022. The project will run from approximately October 24th, when notification was sent on October 21st to awardees and conclude on May 31st, 2023. Now we will start the question and answer discussion portion of the webinar. If anyone has any question, please raise your hand so that you can be unmuted. You may also type your question in the chat box. Darby, would you please let us know if there is any question for us? Thank you.
Munez, the first question is from Christy, and they asked, are there unallowable expenses or costs they should be aware of?
I let Sarah chime in for this question. I think there shouldn't be any, like, just one item, purchasing just one item.
Yes, so there's a few things, because this is a federal grant through CDC that we're distributing these funds. So any expenses for food and drink is always not allowed for meetings. And you also can't purchase large items. I'm looking in the application now because I know we list what that means. So a large piece of equipment over $5,000 would generally not be allowable. So like if you were trying to buy a really expensive computer or something like that, that was over $5,000. You also can't use this funding for direct patient care. So you can't be using this funding for like providing, care to patients that have COVID or anything like that. And you can't use it for any lobbying, advocacy work, anything that might be not allowable by federal funding.
Thank you, Sarah. And I see someone is asking for the recording. Yes, you can send me your request and I will share it with you, or even we can share it on the website. We'll let you know.
And yep, Darby, sorry, go ahead.
Oh no, Sarah, go ahead.
I see a question about gift cards. Gift cards are okay.
Is there any other question? Please feel free to contact us while you are filling out your application and you encounter any question. You can ask us, call us, or email us. We will be happy to answer any question you might have. So if there is no other question, we can adjourn. So we thank you everyone for joining us. Please feel free to email us with additional questions. Thank you all and have a great day and a weekend.
Munez, I do see one more question that popped up.
Okay.
Can you give us some suggestions for activities? I know you have some that are in the slideshow.
Yes, I can go back to that.
And as a reminder, these are suggestions. These aren't the full extent of the activities. These are just some ideas of what could be in these categories.
So one suggestion is purchasing N95 and other supplies for prevention and mitigation the spread of COVID-19, travel, school, purchasing supplies for vaccination event. The other is like purchasing and installing computer software for the data sharing or turning rooms within facilities into isolation rooms. And the third one that we suggested, marketing education material for COVID-19 vaccination, prevention, booster promotion, travel, schools, and community.
I see another question. Is there a final report evaluation?
Yeah, you need to, as I said, let me go back to that slide so you can, oh, maybe that one was it. So you need to submit the final report to us. And the financial, you don't need to, let me, sorry, not here.
Munez, if you'd like, I can step in for this also.
Yes, please. I think I've
yeah,
got a problem.
Yeah, so because we're trying to get this funding out in a way that's as easy for everybody as possible, there is no need to submit a final financial report reporting on your funding. All we're asking for the final report is a report of your deliverables completed. So basically, at any time between you starting the grant and May 31st, you're going to let us know that you've completed all your deliverables. We may ask for some evidence that those are completed, and then we will pay you out for all the deliverables that you've completed at that time. And yes, that would make it like a direct service contract. So we'll pay you half of it upfront and the other half upon seeing that you've completed those deliverables. We're not monitoring your spending with a financial report. And I also see, I think this was sent privately to me about using the gift card. So the gift cards are sometimes used as incentives. So if you were going to have a raffle for people getting vaccinated, for example, gift cards are sometimes something that you might want to use as an incentive.
Yeah, you need to submit a deliverable statement to NHB by May 31st, 2023.
Yeah, and I guess that being said, the deliverables and the financial amount attached to them should be reasonable. So although we're not conducting that financial statement, we will monitor those suggested costs for those deliverables. So that's how we'll make determinations. So you should be able to estimate roughly how much that activity would cost. I'm not seeing any more questions on my end.
Thank you, Sarah.
I don't see any more questions either, Munez.
Thank you, Darby. I know I already adjourned, but I think if there is no other questions, we can adjourn at this time. So remember, you can email us or call us with any additional question you may have throughout the process of completing your application, and make sure you send it by the deadline on October 5th to us. And so if there is no question, we can adjourn. Thank you all and have a great day and weekend.